So now we arrive by the patient's side. The first thing we should do is check for responsiveness. So we want to make sure we approach that patient, but before we touch the patient, make sure you're practicing universal precautions. So wearing a pair of gloves, of course now with the coronavirus pandemic, everybody's wearing face masks. We're probably at the most heightened time ever of everybody using personal protective equipment. So everybody's familiar with gloves now and wearing a mask. But you want to make sure, you approach that patient, you have, gloves on, you have a barrier device to ventilate the patient if need be. If not, and you're in public and you're not acting in a healthcare provider situation, you could do compression-only CPR and not do ventilations. But as a healthcare provider, when we arrive, and we're at work, we should have the proper equipment. So we should have a pair of gloves and a one-way valve device. So when you're by yourself, it's better to use a pocket mask. If you're working as a team, we may use the bag valve mask. So make sure you have the appropriate equipment. So now we're at the patient's side. The first thing we want to do, and I always joke about this, but I work 7 nights a week, third shift. During the day, I may be somewhere and doze off in my car. I want to make sure you check me for responsiveness before you just suddenly just start to pump on my chest. Because, we want to make sure that that person's unresponsive before we do CPR. So check that patient, tap them, are you okay, you all right? And at that point, when you get no response, that's when you should have somebody call for help. Once we've had somebody call for help, or we make that call for help, now we're back by the patient's side. We should quickly check circulation for the adult at the carotid arteries in the neck. We'll check the carotid arteries at the neck, making sure we only use 4 fingers, checking at the carotid arteries, but never use your thumb. Your thumb has a real strong pulse, and what you're going to feel is not their pulse, you'll feel your own pulse. A pulse check shouldn't take that long, and we should have the pulse check take no more than 10 seconds. If 10 seconds has gone by and we do not feel the presence of a pulse, that person's in cardiac arrest, and we should go right to the chest and start CPR compressions. If we do have circulation but they're not breathing, and we have the proper equipment to ventilate the patient, then we should give rescue breaths. Rescue breaths for the adult is 1 breath every 5 seconds. For the infant and child, it's 1 breath every 3 seconds. A lot of times nowadays, now that I've said that, I think, actually the book says 1 breath every 3 to 5 seconds. So even if you did 1 breath every 4 seconds, you're right in between, you're doing okay. But my mind kind of went back to the old way. I've been doing this for almost 30 years. But I always remember adults is 1 breath every 5 seconds, pediatrics 1 breath every 3 seconds. You'll do your rescue breathing. Again, for respiratory arrest, that's no breathing, but the patient does have circulation. If they do not have circulation, they will never have true breathing. So there is what they call agonal respirations. The person could have went into cardiac arrest, the heart is stopped, but we see some gasping breaths after death. That's not true breathing. So if the person's without a pulse, there is never any true breathing, and make sure that you go right to the chest and start your chest compressions. So how are we going to do our chest compressions? Well, we're looking at a bare chest. We're going to visualize the nipple line, and in the center of the chest, we're going to place the palm of our hand at the center of the chest, right on the breastbone, the sternum. So between the nipple line, on the sternum, just the palm of your hand. Don't wrap your fingertips around the chest. That tends to cause you to rock from one side to the other when you're doing your compressions. And that could actually increase the chance of breaking ribs. And when I say that, breaking ribs, it is possible that ribs could break. We're not trying to break ribs. Back in the day they used to say, oh, you're doing good CPR if you break ribs. That's not true. But, we could be doing our compressions and hear some cracking, some popping. Sometimes you may hear some noise and it's just the cartilage between the ribs separating. But we want to make sure that we're always doing our compression. So even if you think you broke a rib, you got to keep going with CPR. Remember, this person's in cardiac arrest. They're dead. If you stop CPR, that patient's still dead. So make sure you continue with the skills even if that does happen. So back to the chest for our CPR. center of the chest, between the nipple line, on the breastbone. We're pushing and squeezing the heart between the backbone and the breastbone. Therefore, that person has to be on a solid surface. So in most situations, that's the ground. That person has to be on the flat ground. It may be a hospital situation where the person's on a stretcher or on a bed and we use a backboard, but there has to be something solid that's not going to give under the patient as we do our compressions. When we do our compressions at the location I mentioned on the adult, and again we're talking about the adult patient, we'll talk about the other ages when we get there, but when we do our CPR on the adult, we're going to push hard and fast on the chest, but at a steady pace. So what is the pace? The pace is 100 beats per minute. So 100 beats per minute, if your old school, is still staying alive. Staying alive was recorded to a heart rate. So that 100 beats a minute, and I'm not going to sing to you right now, but if you know the song, you can think about it. That beat is the rate for your CPR compressions. To be honest, the song Another One Bites the Dust is also 100 beats per minute, but we have to remain positive in this situation. We're trying to save somebody. So Another One Bites the Dust may be good if you're in hospice care, but anywhere else in healthcare, that's probably not a good song to be thinking. So with that, sorry for my sense of humor, but anyhow, and then if you're so young that you don't know any of those songs, then a new one is Baby Shark. If you can think of Baby Shark, do 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 do, Baby Shark, do 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 do. Oh, you got me singing. Anyhow, if you can think of that, then that's also the same rate. Sometimes people have a hard time getting the rate. We use the mannequin that measures depth of compressions and rate, and sometimes when people have a hard time getting that, we'll play the different songs to get them in the groove, and automatically they get right in the groove, unless their rhythm is totally horrible, and then maybe it just doesn't work at all. But most people get it, and most people get that right rate of 100 to 120 compressions per minute. Just 1, 2, 3, 4, 5, 6, and that's where I'm leading to with the ratio. Now, ratio is how many compressions to how many ventilations. So whenever you're alone, whether it's an adult, infant, or child for CPR, you're going to do 30 compressions to 2 ventilations. 30 compressions, 2 ventilations, 5 times in a row, roughly about 2 minutes. And we're going to do that and do it consistently so that we're circulating oxygenated blood through the system. So again, the ratio is 30 to 2. The rate for how fast we're doing our compressions is 100 to 120 beats per minute. So as we're doing that CPR, if we're doing it by ourselves, there's a lot of things to remember, like know your own limitations. This is very exhausting. If there's other people around, try to get them to help out. If we are doing 2-person CPR, we're still doing 30 compressions to 2 ventilations on the adult, but we should switch positions every 2 minutes. We want to remain with the highest efficiency CPR as possible. And the longer you're going on doing compressions, you're going to get exhausted no matter how healthy you are. So it's always good to switch positions every 2 minutes with another person so we can maintain high efficiency CPR. We want to make sure we always maintain the depth. So if we are working in a team and the person at the head's watching the compressor and noticing that the rate or the compression depth is not good enough, they should positively coach that person and say we need to compress deeper, or we need to step up the pace or slow the pace down. So it's important to pass that information along and work together as a team. When we have tons of people in a group, like in an emergency room setting, that's when the team really needs to work together. There may be some people switching off on compressions, maybe respiratory therapy is doing ventilations, maybe IV's drawing some bloods, or the lab's drawing some bloods. There's a lot of people involved, so we have to all play in the same sandbox together and be positive, coach each other, work all well together. But we also have to know what we're doing and what our job is, and that it doesn't work when somebody doesn't know what their job is. You end up tripping over people. So definitely working in a big team, know what the job is. But also know your limitations, as I mentioned. If if you're too tired to do the CPR, or even if you feel like you're having chest pain or you're an asthmatic and you're having difficulty breathing, that's when it's time to find somebody else to take over. So that's the adult CPR. There's not a lot of differences when we get to child and infant. If we're doing one person child CPR or one person infant CPR, the rate is still 100 compressions to 120. Sorry, it's that's 100 to 120 beats per minute at a rate of 30 compressions to 2 ventilations. Now positioning is different because the patient's smaller. So with the child compared to the adult, instead of 2 hands at the location I mentioned, we're only using 1 hand. And the depth is different. I may not have mentioned the actual depth on the adult, but the depth on the adult for CPR compressions is at least 2 inches deep. So that's a pretty deep compression when we're doing CPR compressions on the adult. On the infant and child, it's 1/3 the overall depth of the chest. That's such a wide range of sizes going from infant to child that we have to look at the whole chest and just figure out what 1/3 is. Way back they used to say CPR was a 1/2 inch to 1 inch deep on an infant, inch to 1.5 inches deep on a child. But now it's just 1/3 the overall depth of the chest. With the child, we're using the 1 hand. The infant's different because they're so much smaller that we're going to just use 2 fingers, 1 finger width below the nipple line to do our compression. So just 2 fingertips to do those compressions on an infant. 2-person CPR on a child is still going to be the same hand position, but where we have a compressor and a ventilator, 2-person CPR on the child is going to be 15 compressions to 2 ventilations. So instead of our 30 compressions to 2 ventilations, we're going to do 15 compressions to 2 ventilations on an infant and a child. So the infant, they're really small. It's hard to do the 2-finger compression and for the 2-person. So with 2 people, 1 person will do the 2-thumb encircling hand technique, and they'll wrap their hands around the infant's chest and use their thumbs to push on the chest, and then we'll still have the ventilator at that point, probably using an infant bag valve mask because we're working as a team, probably as responders or healthcare providers. So that would be the difference there. Is infants and children, 1 person is 30 compressions to 2 ventilations when you're by yourself, but if you're working as a team, as at least 2 people, then it's 15 to 2 for 5 times.